happened. Yes, they've sliced that off. They've reamed out the acetabulum, so the ball that it goes into. They've got a reaming machine that sort of scrapes that out, makes it a bit bigger. Okay, and then they put a cup into the acetabulum here, and a stem with a new ball on the end of it into the femur. And that's your new hip joint. Now hips, and you'll both be pleased to hear, are generally far more successful than knee replacements. And the main reason for that is because it's got really big, strong gluteal muscles around there, giving it a lot of stability and strength. Whereas a knee, it's still got big muscles, but they're not quite as big, and it's a bit more exposed, so you've got to work it a lot harder, really, to get it going after the surgery. Having said that, you do get very successful knee replacements, but in my experience, hip replacements generally are even more successful.
So on that picture then, where the neck's showing, there's cut quite a considerable amount of the top of the femur off then.
Yeah, we should have the skeleton out, but basically, they, as you can see in the picture there, they cut the whole of the neck of the femur and remove the whole
thing goes.
Yeah, the whole thing goes. Yeah. That's with the total hip replacement. There's the X-ray. So you can, in fact, you can see it quite clearly in the X-ray there. But there's quite a lot of metal work involved. Now, if you're a younger person and they can get away with it, they were doing these Birmingham hip resurfacings, which on this next one. So the Birmingham hip resurfacing, you can see there's far less metal work. Okay, you keep the neck of femur. It's a small little sort of cup and ball, sort of half a ball. So there's far less metal work involved. The rehabilitation, because you've still got the neck of femur, is a lot longer. So you can't fully weight bear for 6 weeks, whereas with a total hip replacement, you're up, you're walking, and the physios, you'll hate the physios because they don't give you any rest. They're up and you're going as soon as physically possible. Okay. Whereas a Birmingham hip resurfacing, because that neck of femur and the way that you can think of the pressure that, there's my pointer, where it is. So the pressure across that joint, you want to make sure that's fully bedded in and that the bone has sort of knitted on. It is cemented, but it's fully knitted on. So you're partial weight bearing for a 6-week period afterward. That's also why older people, this isn't really any use. If you're 80 years old and you're having to be partial weight bearing with crutches for 6 weeks, most 8-year-olds just couldn't cope with that. They just need to get up and go, basically. Whereas a younger person could.
My brother had that done, but it cracked.
Right.
And he's in the middle of the field and he collapsed and it cracked.
I mean, possibly at that joint.
Yes.
Yeah,
I think it was the joint.
probably the joint there.
Yeah, I think it was there.
So it's just come away, hasn't it? It's just come off. The other problem they were having was it was metal on metal. And they were getting little bits of metal kind of breaking off and going into the circulation. And that was causing sort of metal toxicity and rejection of the joint. So they don't do this anymore. Now I say that, I did treat somebody who had it done because they specifically wanted it, and they paid privately and the surgeon did it, I guess because they insisted that that's what they wanted. But so that wasn't that long ago. I was very surprised to meet someone who'd had it done recently, but I don't think you would have that on the NHS now. Well, I'm positive you wouldn't have it on the